Have you ever attempted to immediately load a Nobel Biocare or Brennemeyer implant?
Yes.
Okay. When did you first try to do that?
3 or 4 years ago.
And what caused you to try to do that?
Well, you hear different conversations at meetings and around the bar that so-and-so has tried it or this one's tried it, so I thought I'd try it.
I assume you advised the patient in advance?
Oh, yeah. Both patients did.
And how many times have you attempted to immediately load a Nobel Biocare or Brennemeyer implant?
Okay, well, sticking to the definition of immediate loading being the day that the implant was inserted or within a 1 or 2 day period, twice.
Okay. The first time was the one you just mentioned about 3 or 4 years ago, and then when was the second time?
Shortly thereafter.
Okay. What were the results of those attempts?
The implants both failed.
Do you know why?
Not really.
Have you formed any opinions as to why they may have failed or why they did fail?
One of them actually may have been an occlusion, and the other one I'm not sure.
Why did you stop any further attempts to immediately load a Nobel Biocare or Brennemeyer implant after those first 2 occasions?
When you lose 2 out of 2, you lose confidence pretty quickly.
Did you report to anybody or advise anybody at Nobel Biocare of these 2 attempts you had made?
No.
Did anybody at Nobel Biocare try to immediately load one of their implants?
No.
Have you ever heard of the Mark IV Nobel Biocare implant?
Yes, I have.
Is that an immediate load implant?
I don't think so, but I don't know. I don't use it as an immediate load.
Is it promoted or advertised, as far as you know, as an immediate load implant?
To be honest with you, I've never seen that. Maybe, but I've never seen it.
Okay. And how do you customarily utilize a Mark IV? Meaning, is it a stage 1 or stage 2 implant in the way you use it?
I will usually use that as a stage 2 implant in patients that have reasonably soft bone with not a great deal of volume, bone volume.
Now, what is the distinction between a stage 1 and a stage 2 implant in your mind?
Well, a stage 1 implant is you put the healing abutment on at the time of surgery, and a stage 2 is the implant is buried, requiring a second surgery 3 to 4 months later.
Do you need a second surgery on the stage 1 implant?
In the broadest sense, no.
But you don't load the stage 1 until a number of months have gone by, correct?
Correct.